Very good morning to you once again and welcome to Ugu Sport and Leisure Centre. It is in Shelly Beach in KwaZulu-Natal. It is here where the official World AIDS Day event will be taking place. Upon the stage, we will see Deputy President Cyril Ramaphosa, Dr. Aaron Motsoaledi, the Health Minister, and the Premier of KwaZulu-Natal, Mr. Senzo Mchunu. And they'll be tackling ways of dealing with the scourge of HIV AIDS infection in South Africa. I think it's absolutely crucial that the event is taking place in KwaZulu-Natal, which has become known as the epicenter for the epidemic. And according to statistics, which are, I should say, very alarming, Doctors Without Borders believes that KwaZulu-Natal has among the highest HIV infection rates in the world, with an estimated 25.2% of the province's adult population living with the virus. Let's speak to the Premier now, who joins us about what they're doing to try and tackle that issue. Mr. Premier, thank you so much for joining. A very good morning to you and welcome.
Thank you very much, and thank you very much to the viewers.
What is it about the province that makes it so, shall we say, susceptible, for lack of a better word, to the HIV AIDS virus and the infection thereof?
Well, I think the first factor would be generally a history of low standards of living, characterized by poverty, among others, characterized by living conditions that make it conducive for people to get to sexual activities of the kind that breeds HIV and AIDS. That is your informal settlements. We've had a proliferation of informal settlements in this province. From rural towns up to the city of eThekwini, almost all the towns and major towns and the city itself, we have teeming informal settlements now, and people gathering from all rural areas to come to eThekwini, and also to come to major urban centers, and generally backwardness in terms of education and unemployment. So those are the factors that have historically contributed to this kind of situation that we're in from where we sit.
So you can't divorce the socioeconomic conditions of the people in the province from HIV infection. But if I may read continuously from this particular study that I found from Médecins Sans Frontières, the treatment coverage was at 75%. And they said that this is good. So the province is making strides in making sure that they do treat those who are HIV AIDS infected. Talk to me now about Operation Sukuma Sakhe and the role that it plays in the eradication of HIV AIDS.
Now, in terms of our plans, we are implementing all our plans meticulously. We are assisted by the United Nations, among others. We are assisted by United States, among others. We're also assisted to a great extent by national government. And we have been able to successfully mobilize all municipalities, Amakosi, and everybody in KwaZulu-Natal, especially at government levels, to be an ambassador, to do something about HIV and AIDS whenever we gather, talk about testing, talk about HIV, ARVs, talk about safe sex, talk about all those matters, such that I doubt that there's anybody in this province that hasn't heard us talking about HIV and AIDS. Now, we then, over and above all those, we have Operation Sukuma Sakhe, which is a government plan, a provincial government plan, which has been adopted by all municipalities, but also national government, which is driven by us at provincial level, but it is situated and operates from wards. Each ward has a war room where there is a committee which looks at programs on HIV and AIDS, testing. People plan from time to time programs on testing. They tell people, they mobilize people to go and test. They mobilize provincial government to come and test people in that particular ward. They talk about ARVs for those who need ARVs, like, for instance, people who are not able to walk and so on and so on, collect them. They make it easy for them. They talk to clinics. They do everything to make sure that everybody who needs ARVs access them accurately, and they get food and they get all the information that is necessary, distribution of condoms. When we go to each and every war room, we count how many condoms did you distribute last month. We count how many people tested. We count how many people, especially the boys, who did circumcision. We do all those programs. How many gatherings were there? We take them up on those. And it's just bearing fruit, because apart from everybody knowing, but we're seeing statistics really responding positively to what we're trying to do.
Well, Premier, thank you so much for your time. Unfortunately, we've run out of it. We were hoping to get a little bit more out of you, but it does seem like a lot is being done. More still should be done, as we believe that there are great strides that have been made, but the way forward is still quite a long journey to make sure that we live in an HIV-free generation. But let's leave it there, at least for now. We talk about stigma, we talk about myths as well a little bit later on the program. Do stay with us.